Thank you so much for joining the Dr. Whisperer podcast show. I am your host, Sharon Feckety, and you are here to listen to others talk about the business of medicine. Don't forget to subscribe, share it with somebody else that is in the business of medicine so we can all learn together. Thank you for being here and enjoy the show. Recording in progress. That is us today. And I think I'll start with this new DJ voice. Just for fun, because we are on the Dr. Whisperer show where, you never know what you're going to get, but we will have fun. That's for sure, because life is way too short not to have fun. So whether this is the first time you've listened or watched, or you've been just hanging in there since 2018. I'm so glad that you are here. Dr. Shah is here with us today, and we've been having some fun, of course, before we hit record, and we hope to continue that same fun throughout the show. Welcome.
Thanks very much, Sharon. It's great to be here.
It's great to have you. So you are the Chief Medical Officer of Aktiia. Let's just put that out there first. But there are many, many, many more things that I'm interested in, dare I say. I'm very interested in this startup because I like anything that has app associated with it that has to do with healthcare and technology, where there's a wearable and on and on. But I am very excited about you as the human who has, become a cardiologist and all the things, very smart, and I'm very jelly. I can't become a cardiologist, but I can talk to one whenever I want. But you have not chosen an easy path, which I love. And that was one of the things that we were discussing before I hit record. And I promise you will hear more from this wonderful doctor than you'll hear from me during the show. But to start and set up this foundation, I want to talk about how when you stay in the same sea of sameness for too long, it's almost a guarantee you're not going to be so happy.
Yeah,
that's
that's certainly been my experience, in my opinion. And some people say I get bored too easily, but I don't think that's it. I think so. When I came out of, I guess the good example would be when I finished my training after I trained medical school and internal medicine and cardiology, and then I kind of did something a bit different, and my mentors all kind of looked at me funny, and I said, "Oh, I'm going to go start my own practice." Which is not a normal thing these days.
Not normal.
A physician trained in sort of modern cardiology to do. So I went out to Portland, Oregon, and basically started my own practice from scratch. Two EKG machines.
Wait, why Portland? So you chose a demographic to run a cardiology practice alone, where, just to suit this up a little bit for all of you that have come out of medical school and gone right into a hospital or a large practice. That's the norm. Not every doctor is like, I'm going to start it up, because you already have hundreds of thousands of dollars of loans. And now to put on more stress, why Portland, Oregon?
So that's a good question. But at the time, this was 2012. So just a couple years after the Great Recession. Mm-hmm. And it was also before the Affordable Care Act actually went into effect. So physicians were not retiring because they were waiting for their 401ks and their retirement accounts to go back up. And hospital systems were not hiring because they were not sure what the Affordable Care Act would do, and they didn't know how they were going to deal with it. So, and my wife's a physician too. So it was actually a very difficult time to find two physician jobs in the same place at the same time without going out into a very remote sort of rural area. So we looked at kind of all across the country and happened to get an opportunity in Portland. And we did want to try something different. We did want to kind of check out the West Coast. We both lived in the East Coast and the Midwest, as we talked about before the show started. So we did want to, it was a time in our life. We said, let's pick somewhere where we think we might enjoy for a while and just try something different.
Good for you.
And so sort of both by chance and by lack of other options, Portland was the place we ended up. And so that's a story how we got to Portland. And so, yeah, we went there and I decided, let me try this. It was basically setting up practice from scratch with 2 EKG machines, a medical assistant, and that's it.
Right.
And so, but it was in the middle of metropolitan Portland. There were multiple large groups in town that I would be sort of competing with, but it was a really tremendous learning experience. So at the same time, those first few years out of training are really the sort of formative time in a physician's career. You really learn what you don't know. You learn humility. There's no backstop most of the time. You are it, and you're going to make mistakes, and you're going to have to try to figure out how to deal with them. And at the same time that I was learning all that, I was also learning how to negotiate contracts with, vendors, and how to do par levels, and how to hire, and how to manage people, and how to do real estate transactions, and how to do cost-effective analysis. And
you thought so much fun.
And some part of it, of course, I didn't enjoy, but I really did enjoy learning about sort of those business aspects of medicine. And so that, was quite successful in the end. It was a really bustling, busy practice after about 7 years. But to your original question, after about 4 years, the practice was set up. I was getting way more referrals than I knew what to do with. There was the building process had finished, so to speak. And then it was just sort of growth of that business. And after about 5 years, I started to feel stagnant. I started to feel like, okay, I can do this. I can see all the patients and do the work, but the real sort of curiosity and excitement of building something new and learning those sort of skill sets that I never had before were gone. I mean, not gone, but had sort of completed by then. And that's when I started to feel like I probably need to make a change now. Even though on paper, it was quite successful. And if I was probably of a different mindset, could have just done that for 25 years and had a very successful practice. And by all standard measures, would have been good.
But you were like, no, I got to try something new.
Yeah. So then
Screw that success.
After about
I'm out of here.
I started looking, and then my wife and I got an opportunity at the Mayo Clinic in Arizona. So we moved to Phoenix, and that was also sort of an interesting place and learned a lot. I set up a complex program in thoracic aortic diseases, so complex aneurysms, and so that was interesting in sort of a building aspect, but it was done within this very large, very, big and sort of bureaucratic organization. It's a legacy sort of medical organization. And it's great for certain things, but definitely it was probably not the right place for me for the long term, because again, after that building process complete in that sort of that niche that I had set up, it was
being an entrepreneur will ruin you for life.
I found that I was sort of butting up against the sort of bureaucracy of the system. And I felt like, okay, I needed to find something drastically different than just clinical medicine. And that's what led me down a fairly long exploratory path and to eventually to Aktiia, which is a startup. And so I started part-time and then eventually took the leap and I said, okay, I'm going to go full-time. And so now I've been full-time.
So did they find you or did you find them?
It was actually funny. So I was looking for almost a year and interviewing for different roles and crossing things off. Actually, that was the most helpful, just to start, to talk to people, to interview sometimes and be like, no, that doesn't sound exciting. And no, that's definitely not that.
It's a nice position to be in, though. A great position to be in.
Yeah. So that's sort of the comfort and the security of medicine gives us that. And you can continue your practice while you look for something else. And at the same time, even when I did find them, you don't have to leave it. You don't have to leave practice fully. You can kind of dip your toe. You can do a consulting agreement. You can be an advisor. You can start part-time. Most of the companies are going to, sometimes they want full-time, but most companies are going to agree, like, yeah, keep doing your clinical practice. We'll take 20% time, 50% time, some percentage of your time. So you can kind of try before you buy, which was good.
It's nice.
And then it just so happened. So it took a long time. It took a year, and I was about ready to stop for the holidays. And I was like, I'm done with this. I need to take a break. Because it takes a lot of energy. And this was the last thing I saw on LinkedIn before I just put pause on my search, and it was like a posting that just was there. We want a cardiologist looking at who knows something about hypertension, high blood pressure, and digital health startup. And I said, that sounds like me. So I just sent in my application and then didn't think much about
that's
it.
Me.
And then that's it. And they called me right back, and one thing led to another, and
Wow.
took a month, and that was it. Done.
And then you moved to Boston.
No, I stayed in Phoenix for a couple of years, and then now that I'm sort of full time with the company and sort of untethered from hospital and clinical site, then we kind of wanted to move back closer to family and friends and area that we kind of enjoy living in. So,
oh, good, excellent. So, I hope that for all of those who are watching and listening, how it can be, some people are crippled by fear, I believe, of trying something different. And I understand it, especially when it comes to, I mean, I've been told I'm crazy a bunch of times for more reasons than one, but the last practice that I was in for 8 years, similar, I get that itch about 5, 6. I'm like, my head's like out the door. I'm thinking of 9 different businesses that I want to build. And when I finally leave, and now, looking back 10 years later, I'm so glad that not only did I move from managing a practice, and I came from multidisciplinary in New York before I moved to Tampa Bay, Florida. I have had all of these great positions, but it doesn't, at the end of the day, if you are not content and fulfilled, you're not going to stay.
Yeah, that's right.
Right? If you're smart.
Right. Well, yeah, that's true. Right. There's a lot of people who do stay.
They do.
And who are just
and
not very
compromises
happy.
their health, their mental and their
health,
physical health.
And they stay for all kinds of reasons: security, safety, fear, money. And I'm not judging. Sometimes there's not a choice for them.
That's
Sometimes
right.
they're the only breadwinner for the family, and they say, I got to do this. And I get it. So I recognize very much that I'm lucky and grateful to have a partner who also works and has been able to support me when I wanted to take a risk. So I think that's crucial, to feel
Shout
that.
out to all the spouses that do that.
Absolutely. I think that's crucial to have that partnership and support, because otherwise I don't think I would have changed as much. But I do think that in the end, at least for me, again, not speaking for anyone else, is that I think you can see pretty clearly on your face, in your heart, in your soul, when you're not content, when you're not happy. I think people bring that home. I think your children can see it. I think your spouses can see it, and they can feel it. Versus if you're really excited about something and you're very passionate about it, I think that's also tangible and recognizable. And I think that those are the things that really help me get over the sort of fears and uncertainty and doubt, self-doubt, which is all natural. To say like, oh, I'm going from being an expert in, working at Mayo Clinic and being an expert in aortic disease and cardiologist for over a decade to now all of a sudden I'm going to present to investors, and I'm talking to boards, and I'm presenting at conferences as an industry expert, and all these sort of different roles, and realizing that, generally 90% of the time you have that information, knowledge already. It's just a matter of like showing that in a different way. And it's not something that as for physicians, a lot of times these physicians are actually just, I feel like it's empowering, because it's taking what you know and what you have known for decades, for years, for training, of working. That real world experience is exactly what is lacking oftentimes in the industry arena, whether it's at conferences or on board meetings. You are primarily the expert in the room, especially for health related businesses. And no one else at that table knows how it is to treat patients, and to do it in the real world, and to do it in our system that we work in. And that's So you're an expert. And so you got to remember that. It's like,
Yes.
you bring your expertise, you are the expert. And that does a lot to dispel the fear oftentimes.
It's awesome. Every doctor knows that their traditional insurance only goes so far. Dare I say malpractice? These are real risks that keep you up at night. Real risks, like you have to consider them. So SRA 831B admin helps businesses fund their own PPP plans. Did you hear that? Is that making sense? So SRA 831B admin helps you mitigate risk and lower your tax liability by putting money into a vehicle that's tax advantaged. You need that. You know, dentists that were deemed non-essential, remember that in the pandemic? The ones that had these 831 plans, they were able to file a business interruption claim and use their tax advantage dollars. So what are you waiting for? Check out SRA 831B admin. You won't regret it. It made me think of, I remember when electronic health records, I'm showing my age now, but I was in my 20s and I was working in Manhattan. And, you know, we had to hire, it was the time of like HIPAA and electronic health records. And we had a compliance officer on staff and everybody was scared to death about the file cabinets, you know. And I remember all these electronic health records and all of the doctors just on a consistent basis, just complaining to us in operations that, you know, the system is terrible and they don't know this and that. And I would, from New York to Florida, it didn't matter where I go. I never could understand why these companies did not speak to the physicians.
Yeah.
So, I mean, I couldn't have laid that up any better. And I can't even believe I'm using a sports reference here, people. You heard it first. The girl who just went to see the Barbie movie is talking about layups. So let's talk a little bit about how you are helping Aktiia improve hypertension diagnosis, because it is a tech company and a healthcare, and boy, am I happy that they have a cardiologist, you know, informing them, because it does scare the shit out of me a little bit when I'm like, you're going to do what? And you don't have doctors on board. Okay. So please help us.
That's not an uncommon scenario. So Aktiia it's a Swiss company, and the founders are biomedical engineers, and really sort of pioneers and experts in optical signal processing. If anyone doesn't know what that means, basically it means, what do you do with these green lights that come out of the things that you wear? Okay. And that creates that are trying to measure physiologic parameters. So 20 years ago, they did sort of the pioneering research that enabled us to using those sensors in wearables to derive heart rate. And after they really got good at that and expert at it, they turned and said, well, what other physiologic parameters can we try to measure with these signals? And they started working on blood pressure. And for them, it's been their life's work, and over 20 years of incredibly intense and brilliant research in animal models and then human models, all based in Switzerland, to the point where they got to where now using their technology and these optical sensors, you can derive an accurate blood pressure passively, automatically, and continuously throughout the days, nights, weeks, months, and years. And so that was the central core technology innovation. Really, nobody else has been able to do that in a footprint that somebody can wear day in, day out, week after week, month after month, year after year. And why is that so important? It's because high blood pressure or hypertension is the most common chronic disease in the world. 1.4 billion people around the world have it. 130 million Americans have it. 1 in 2 adults over the age of 65. So either all our listeners, one of you is going to have it, I'm going to have it, or someone who you love is going to have it. And it is the primary factor of cardiovascular disease and death in the world. And we're not very good at treating it. Only about 20% of people who have high blood pressure actually have it under control. And in the United States, 26%. So really not that great. So around this core technology innovation of a sort of a continuous blood pressure monitor, now we're building software and interfaces for both patients and physicians to enable them to track understand and optimize their blood pressure over the long term. And the key is time. Typically people know how to check their blood pressure with a cuff, right? Everybody knows and has done that at least once. You have a one-time reading. That cuff reading represents 1 point in 1 day and 1 moment in time. And the actual risk of high blood pressure is, what is that blood pressure? How far out of the normal range is it? Not at that 1 point in time, but over months, years, decades. That's how it causes its damage. It's over that long period of time. So the tool that we use historically to measure blood pressure is so extremely counterintuitive about the actual how blood pressure actually works and damages the body. So the idea is that we have a continuous blood pressure monitor that's super easy to wear, that really allows someone to track and display and interact with the data that is much more representative of blood pressure driven risk. And that's really at the core of what we do.
Thank God for technology. Really? Yeah. I mean, and you, you're very important in all of this. Come on. But really and truly, there's such advancements, and isn't it interesting that it's not always in this country that we get these wonderful people that are committed and then integrate with technology and then bring on a cardiologist to have something that can help us live longer, because it does seem so ridiculous to sit down and have that big old cuff around you and that's it, because I always have great blood pressure. I'm super calm when I go to the doctor. I work with y'all. I've worked with y'all for 20 plus years. My husband's blood pressure is never good when he goes, but that is not his every day, every minute.
Exactly.
So, makes sense. I'm glad that you laid that out, because my goodness, I didn't know what the heck you were talking about in the beginning, but you really know what you're talking about in terms of what do these mean? These green beeps that are happening. I mean, I have an Apple Watch. I don't wear it all the time. I wear it when I'm exercising. And, I always think that when that day comes and something happens, not that I want it, but there's going to be a lot of tracking mechanisms attached to my body that they'll be able to look at the data, right? And we want to be able to look at some kind of raw data to see what was actually going on with us.
Yeah, I mean, I think that's where all sort of medical sensors and technology are going. There's going to be a lot of fits and starts, and things will get consolidated, eventually. But I think this is where innovation is right now in terms of medical sensor technology. It's going towards more at-home use, more patient-driven. And that's how we think about it, is really empowering the patient with that data, as well as their physician and healthcare. But the patient is the one at the center of their own data, because they're really the ones in charge of their own chronic, and long-term health.
Totally. And, I'm always talking about this panorama, because I'm grateful that we at least, in the healthcare industry can understand that this works, right? Yes, we're doing a podcast. There's nothing clinical happening here, but we were thrust finally, into telehealth and empowering people to get comfortable using more technology. I know that this is a completely different technology, but we've kind of been antiquated in the healthcare arena with bringing this to the form, because there's so much resistance, and it takes, dare I say, a younger generation of physicians such as yourself to, you come out with a different mindset that what is sometimes in the offices that I have gone into here, when they still haven't transitioned even from paper. I get a headache when I talk about that. So let's not do that to myself today. But there are doctors' offices out there today that don't even have electronic health records. That is the truth. And I'm sorry to tell you that today, everybody. But I do think that there's hope. You know what I hear? I hear hope in your voice.
Well, I mean, yes, I haven't lost that yet. And I think you're right about, medical industry is going to take a lot longer. That's why any regulated industry or regulated sort of product is going to take a lot longer to develop than an unregulated one. And all you have to do is look at the disparity between advancement and innovation in healthcare and advancement and innovation in, let's say, unregulated software business or AI or these sort of things that, that really drive markets and drive attention right now, which are really consumer products that have really little to no regulation, really little to no guardrails around them. And that's where the innovation really gets super fast. Whereas healthcare, there are so many limitations, restrictions, stumbling blocks, and way too many, players in the
humans,
and sort of fingers in the pot, honestly. Yeah. That are trying to control their own, slice of the pie.
Yeah. I just said recently, somebody asked me why I used to restructure medical practices all over the place, did that for the last 10 years. And somebody asked me why I didn't do it anymore. I said, well, as soon as, it's run by robots, I'm there, bro.
Yeah,
I'm right back,
Yeah.
It can be very slow and bureaucracy and all of that comes to mind. And the beauty of these startup companies, the beauty of it is that there's nobody stopping anybody to do something great.
Right.
If you always have to have the right people. I joke about the robots, kidding, not kidding. But you have to have the right amount of people that have different skill sets too. You bring a whole different skill set than the team that is creating this wonderful technology. And there's hope in what you're saying. So I have really enjoyed talking to you. I love nothing more than doctors and tech coming together. And who knows, right? I mean, who knows what's ahead on this journey? I just think that when my mother worked in cardiology, my mother's an echo tech. So she would love for me to say that on the show today. Mom, if you're listening or watching, I've only heard about the carotid artery my whole life. Both my parents working in hospitals and me only being on the business side of medicine, I've always checked out when it comes to the clinical, still to this day. But when I hear technology finally coming and having the right business people, we can do great things,
Let's hope you're right. We're going to keep trying.
We are going to keep trying. And I'm so, glad that you have. I just wish what you have done for so many other physicians that you can try new things. If this panorama has taught us anything, right? We realize we only have one life.
That's right.
Let's try something new.
And that part is, I have no regrets actually. And even if the startup doesn't work, doesn't go anywhere, let's hope that doesn't happen. But even if it does, I mean, the amount I've learned in the last 2 years pretty much surpasses the amount that I learned in the last 10 years of practicing medicine. So it is dramatic. And it's not always, career paths, I think medicine, we don't necessarily see that, but in everything else, career paths zig and zag and they go up and down and things change and you might drop your income, but you might be learning so much that it's worth it. And so understanding those trade-offs and understanding, where you can learn and where you can grow, to me is the most important thing. I had a very blunt friend tell me one time is that, if you're not learning, you're dead. That's what he said. And in the business world. And so, and I think that's, I wouldn't put it that way necessarily, but I think it's right.
Was this person from New York?
No, it wasn't.
Well, it is true. I agree. And I have felt it myself. I have had, I'm going through it, again, my husband doesn't understand why I would always want to torture or reinvent. I'm not sure which word I want to use here to describe it. Reinventing myself all the time because I learn something every time I do it. Yeah. And I learn what I love and I learn what I don't love. And I won't ever repeat the things that I don't love.
Exactly. Totally agree.
Quality time remaining, QTR, a wonderful acronym that a friend here taught me, and that's all we got. So quality time remaining on Earth. Let's make the best of it while we can.
Got
right?
it. Totally.
Yeah. It's such a pleasure talking to you today.
Likewise.
Thank you for all you do. All of the show notes will include how you can learn more. So please be sure to check out Aktiia. Did I say it right this time?
Aktiia.
Aktiia.
That's wrong.
Man,
Yeah.
I said it right every other time. I should
Yeah,
have
you did.
stopped while I was ahead. All right. Bye, everybody.
All right. Thank you, Sharon.
Thank you. Don't forget to mitigate risk. Visit 831b.com for more information.